Hello, everyone. As you're joining, welcome. We are just going to get started in a minute's time. Okay. Well, hello, everyone, and thank you for joining us today for this webinar about carbon monoxide poisoning in Canada. And Parachute is pleased to present this webinar in collaboration with the Canadian Association of Poison Centers and Clinical Toxicology and the Toxicovigilance Canada Public Outreach and Communications Working Group. Before we get into today's webinar, I'd like to acknowledge the land on which Parachute is located. And for thousands of years, it has been the traditional territory of the Wendat, the Anishinaabeg, the Haudenosaunee, the Métis, and the Mississaugas of the Credit First Nation. And today, this land is still the home to many Indigenous people, and we are grateful to have the opportunity to work and live on this land. And while we meet today on a virtual platform, we encourage you to take a moment to acknowledge and reflect the importance of the lands which we each call home. Some important information for our webinar today. First of all, this webinar will be recorded, and a link to view the recording will be shared with each and every one of you. The recording will also be available on Parachute's YouTube channel. We will have time for questions at the end of the webinar, so please use the Q&A function that you see in the Zoom menu to submit your questions. We will also have folks monitoring the chat should you have any technical issues or questions you want to bring forward to us there. At the end of the webinar, when you're leaving, you will be prompted to complete a short evaluation survey. It'll only take a minute or two, and we really appreciate your feedback. It's valuable to help us guide future learning opportunities and make sure that these knowledge exchange and informational opportunities are useful and valuable to you. So please do take a moment as you're exiting to complete that evaluation. I'm really excited about the speakers and the agenda that we have today. We have some really interesting and varied perspectives. So I'll go ahead and introduce our speakers for today. We're going to hear from MaryAnne Carew, who is a certified specialist in poison information at the Atlantic Canada Poison Centre. MaryAnne is a registered nurse and has been for 39 years. MaryAnne graduated from VG School of Nursing in Halifax in 1984. Her clinical experiences include adult pediatric nursing, adult oncology, and she worked with Canadian Blood Services. MaryAnne has 23 years of poison center experience and has written her certified specialist in poison information exam twice. She is very passionate about poison prevention and has worked on planning Poison Prevention Week for their Poison Center for several years. Christina or Christy Amaral is a policy analyst at Public Health Agency of Canada. She is a practitioner of design research who currently applies a human-centered lens to her work. She positions herself at the intersection of disciplines, the technical and the human, the quantitative and the qualitative, to help teams uncover and apply shared insights. She's a newcomer to Moncton, New Brunswick, the traditional unceded territory of the Mi'kmaq peoples. And Samantha Hoffmann, apologies, there's a typo on our slide. It should be Hoffmann with two N's. Apologies, Samantha. Samantha is Deputy Chief of Community Safety at Caledon Fire and Emergency Services Team. For more than 30 years, Samantha has worked her passion for community safety and fire prevention. She specializes in fighting fires before they start, with education campaigns that weave informative and fun community campaigns and partnerships with her own public speaking and published articles. Her fire career began at the internationally renowned Hospital for Sick Children in Toronto as fire marshal and emergency planning coordinator. She took the exacting standards she experienced there to North York's fire department in the rank of firefighter with the duty of fire prevention, public education, and media. When North York amalgamated and became part of Toronto Fire Service, Samantha worked as acting captain until 2011, when she joined Barrie Fire as the public fire and life safety officer, eventually becoming active chief fire prevention officer. In 2022, Samantha became deputy chief community safety for Caledon Fire and Emergency Service. In 2014, Samantha was named Public Fire and Life Safety Educator of the Year, awarded by the National Fire Protection Association, only the second Canadian and first Ontario educator to receive it since its inception. And last but certainly not least, we have John Janak, who is executive director of the Hawkins Janak Foundation for Carbon Monoxide Education. Having retired from the Brantford Fire Service as a captain, John started the Hawkins Janak Foundation for Carbon Monoxide Education in 2009. And just before his retirement from the fire service, John lost his niece, her husband, and their 2 children in December 2008 to carbon monoxide poisoning. This tragic incident has motivated John over the last 14 years as the executive director of the Hawkins Janak Foundation to educate Canadians on the danger of carbon monoxide poisoning and to advocate for improved carbon monoxide legislation across Canada. Over the years, John has received multiple awards for his outstanding efforts to improve the safety of all Canadians, including being named the Order of Ontario in 2015. John is committed to continuing the efforts of the Hawkins Janak Foundation until all Canadians are protected equally from the risk of carbon monoxide poisoning. And thank you all so much for being here. You can see, I'm sure, why I'm so excited to have this lineup of speakers on our webinar today. And just before we begin, we do want to put a bit of a frame around carbon monoxide poisoning in Canada. What does the injury picture look like across the country? So for 2021, the 5 poison centers in Canada reported 1,987 cases of carbon monoxide exposures. And we're going to hear today in this webinar a bit more about the poison center perspective of carbon monoxide poisoning. And each year in Canada, there are more than 300 deaths and 200 hospitalizations that are related wholly or in part to carbon monoxide poisoning. These are largely preventable. And again, today we're going to hear more about prevention, particularly through the uptake of carbon monoxide alarms and policy change to ensure carbon monoxide alarms are in all of our private and public spaces. So with that, I'm going to hand it over to our first speaker. So please join me in welcoming MaryAnne Carew from the Atlantic Canada Poison Centre.
Hello, good afternoon, everyone, and thank you, Stephanie, for that introduction. Thank you for joining today. I hope that you enjoy this presentation and learn how important this topic is. And so without further ado, I'm just going to continue. You can advance the next slide. Thank you. So the objectives of my presentation today is to look at the number of calls to Canadian poison centers, give you an overview of symptoms of carbon monoxide poisoning and how we treat carbon monoxide poisonings, look at some case presentations that we actually received from the poison center, and look at prevention of carbon monoxide poisonings. Next slide, thank you. So as Stephanie gave you that statistic, in Canada in 2001, there were 1,987 cases of carbon monoxide reported to poison centers. I want you to know that that is just the tip of the iceberg. There are many cases that we don't hear about, whether they don't call us, whether was misdiagnosed and not seen as a carbon monoxide with somebody that had some milder symptoms, or if somebody was deceased, we don't receive those calls. So next slide. So what is carbon monoxide? It is a non-irritating poisonous gas. It's a gas that you can't see, you can't taste, or smell. And that's what makes it so dangerous. That's why we call it the silent killer. How is carbon monoxide produced? So it is produced by incomplete burning or combustion of carbon containing material. Those materials are things such as gasoline, heating fuel, propane, oil, wood, and coal. And carbon monoxide is also one of the components of house fires, smoke inhalation. Next slide, please. So what makes carbon monoxide so poisonous? This is a simplified explanation, but carbon monoxide is harmful when we breathe it in because it displaces oxygen in our bodies. So our bodies prefer carbon monoxide over oxygen, and therefore the blood is deprived, oxygen is deprived, several of our major organs in our body are deprived of oxygen, such as the brain, your heart, and your lungs. So one of the things that so carbon monoxide is rapidly absorbed when you breathe it in, and it stays in our bodies for about 4 to 5 hours if you weren't treated at all. If you received oxygen, that is cut down to about, and this is 100% oxygen, it's cut down to about 1 to 2 hours. And if somebody receives hyperbaric oxygen, that time frame is about 20 minutes. And we can get back to that in a minute. One of the things is that carbon monoxide can cause both permanent neurological symptoms and death. Next slide, please. So who is affected by carbon monoxide? Basically, all of us are. But some of the groups of people, individuals that are at higher risk are pregnant individuals, the baby, the fetus is at risk. Young children are more susceptible. People who work in and have work environments that they are operating machinery with poor ventilation, such as a forklift in a warehouse, or I know we're in close to PEI, so sometimes we do get calls from equipment and potato warehouses that may have difficulty with their ventilation, and people become symptomatic. Also, anybody who has any pre-existing health conditions, the elderly. And animals, they're very small, so they're very much at risk for carbon monoxide poisoning. So we should always keep this in mind as well. Next slide, please. So this is a slide that our Poison Center worked on with Child Safety Link for Poison Prevention Week last year, because we wanted people to know, we wanted to make this infographic to let people know what are the common sources of carbon monoxide in your home. So gas or wood oil furnaces, improperly ventilated, gas, propane, or water heaters, gas or propane dryers, gas or propane charcoal barbecue. Now, some people may open the door of their garages and put their barbecues in their garage, especially during bad weather events. And that is definitely a source of carbon monoxide coming back into your home and exposure. Gas or propane stoves, improperly ventilated or improperly working. Cars, something that people do often is they open the door of their garage and they run their car first, and thinking that if the door of the garage is open, then it should suffice with ventilation, but that's not the case. I mean, sometimes when you think about the design of homes where bedrooms are above garages, definitely can leach into bedrooms especially. Blocked vents or chimneys. So if you're burning wood and your chimney has not been cleaned and there's a lot of buildup of creosote and it's not properly ventilated, that can be a definite concern. And portable fuel generators. This is something that we see especially during significant weather events. People have their generators. They may open their garage door, run it in their garage, just open their front doors, have it running by their front doors. If you have a ventilation system in your home and you put the generator by the intake valve, these are just sometimes when you can be exposed to carbon monoxide in your own home. And just to make mention that carbon monoxide fumes can only be detected with a carbon monoxide alarm. And I'll just go to the next slide and talk a little more about that. So when you think about carbon monoxide, what are the symptoms? So something that is a concern is that early symptoms are very vague, like flu-like symptoms, viral symptoms. You may feel a little tired, or you may feel weak. You may feel dizzy, have vomiting, diarrhea, a headache. Right off the bat, if you have these symptoms, your mind doesn't go immediately that I think I'm being poisoned by carbon monoxide fumes. So these symptoms can mimic flu-like symptoms. Some of the late symptoms of carbon monoxide, that can actually make it very dangerous because somebody may not be able to get out of their homes if they're confused. Breathing problems, chest pain, loss of consciousness, and death. You can advance to the next slide, please. So I just wanted to talk a little bit about some cases that we've handled at our Poison Center. And the first one is, I mentioned that during significant weather events, we do see an increase in calls, and particularly with generators when there's a storm. So this particular case that we had was the person had a generator running in his garage with the door open. They developed sudden onset of a headache, nausea, and fainting. Thankfully, a family member was very worried because the person would not answer their phone, and decided to check on family member. that's when they went and found the person unresponsive and barely breathing and surrounded by some vomit. This particular call I do remember, as there was a significant snowstorm and 911 was called, and there was a time lapse in 911 being able to respond. It was a remote area, very bad storm. I think it was actually going to take an hour for 911 to get to the person. CPR was initiated by a family member, and the person had gained consciousness. I think that it took the hour, and it took an additional 2 hours for the EHS, the ambulance, to get the patient to the hospital. But when the ambulance arrived on scene, they initiated oxygen, 100% oxygen immediately. The problem with that is when it took 2 hours to get to the hospital, they only have a certain supply of oxygen on their vehicles. But luckily, this person went to hospital and received continued oxygen and was fine after that. So survived. Next case, please. So again, when you think about significant weather events, it's not only generators that can be a concern with carbon monoxide. This was a call that we received, a case we received, that 3 individuals were stuck in mud. The exhaust in their car was blocked. They were in their car for about 3 hours, and they developed symptoms of confusion, nausea, headache. When help arrived, they were all treated with oxygen, and they were all assessed in the emergency department, and all recovered and were discharged. Next slide, please. So recently, the Atlantic Canada Poison Centre was involved with this case. It was a multiple unit apartment building. The furnace in the building affected. I don't have an exact number. There were varying symptoms over a 24-hour period. I believe initially it was a youth that had symptoms, again, headache, gastrointestinal symptoms, was taken to the emergency department. There was no thought that it may be carbon monoxide, and they were actually discharged because they were felt to have a viral illness. Then as the hours passed, more people became symptomatic, ranging from dizziness, headache, to vomiting, to loss of consciousness. As I said, carbon monoxide was not suspected initially. Carbon monoxide levels were very high in the building. When the fire department were on scene, the building was immediately evacuated. Now, brings me to the question, was there carbon monoxide detectors in the building? I'll leave that up to you to decide if what you think. Treatment was initiated, 100% oxygen, and several people were hospitalized. All victims thankfully survived. Next slide, please. One of the biggest things that we want to relay to people is carbon monoxide is 100% preventable. So people should know what the sources of carbon monoxide is in their home or their work environment. Install both carbon monoxide and smoke detectors on each level of your home, particularly ones with a battery backup in case there's a power outage. Ensure all your appliances and heating sources are working properly and professionally maintained. That is really, really important for people to do regularly. And never use fuel-powered machinery indoors, even if the doors are open. Ensure your vehicle exhaust is clear, especially if there's a snowstorm and your car is outside and there's snow all around your car. Make sure you check that. And know the signs of carbon monoxide poisoning. Next slide, please. So, of course, if you feel that you've been poisoned, we have a national poison number, 1844 Poison X, as you probably all know. If you think you've been exposed to carbon monoxide, get out of your home, get out of your work environment, call 911 immediately, and give the Poison Center a call. The Poison Center will be very instrumental in recognizing a diagnosis of carbon monoxide and recommending treatment. Next slide, please. So what are some takeaways from my presentation? Firstly, recognize the symptoms of carbon monoxide. Know that they can mimic flu-like symptoms, and if you think about it, just kind of have this in the back of your mind, especially if there are more than one person feeling unwell, or these symptoms are worse when you're at home and when you go to work, they're better, or vice versa. Prevention with carbon monoxide detectors and carbon monoxide detectors, and maintain the equipment in your home. Make sure it's in good working order. Know the sources of carbon monoxide in your home or workplace, and support legislation for safe housing. I'm sure that's probably going to be spoken to about today, but with this multi-unit apartment building, more than 30 people involved without any knowledge that they were being exposed to carbon monoxide. Poison centers do play a role in diagnosing and treatment of carbon monoxide. So give us a call. Encourage people to call us if they feel that they have been exposed to carbon monoxide or are having symptoms. And thank you for listening today. And that's my presentation.
Thanks so much, MaryAnne, for that really valuable information. Really timely as we get into the winter months here in Canada. Ice storms, snowstorms, other events, something that people maybe don't think about. And those of us who communicate out to the public and try to educate may not be thinking about sharing those key messages about carbon monoxide poisoning. So certainly something very relevant to the season. Thanks, MaryAnne. And now we'll hand it over to Christy to continue.
Thank you, Stephanie. Hi, everyone. I'm pleased to be with you today with this working group to present to you all a case study that myself and a few colleagues in the Human-Centered Design program out of Algonquin College in Ottawa, a case study that we did on carbon monoxide perceptions and preventive actions among homeowners. And this work was done with the support of my now colleagues at the Public Health Agency. And through my employment, I've been able to, be exposed to the excellent work that's being done in surveillance, including around poisoning and injury prevention. And I think that this case study provides a complement to some of the work that you might be more familiar with, whether it's, more the statistical and quantitative side. Today, we're going to look at more of the human behavioral side. So I hope that today what you'll walk away with is some food for thought in terms of how a more human experiential behavioral aspect, how that might enhance the work that you're currently doing. So if we jump into the next slide, the research that my team and I conducted was really centered around an awareness and action gap. So what do I mean by that? When we started to become familiar with this problem space, we learned awareness of carbon monoxide is generally high at least at a collective scale, right? It's been in the public eye for decades. There's a lot of information available from a municipal level all the way up to a federal level. And MaryAnne gave us examples of the wealth of information that's out there. But yet what we were picking up on was that that awareness has not necessarily been translated into action at a collective scale. So this is what my team was curious in studying, this gap. What's behind it and how might we start to close that? So if we go to the next slide, this is our research study in a nutshell. So what we wanted to uncover specifically was the cognitive, the behavioral, and the emotional aspects of carbon monoxide prevention among homeowners. And that's what these 3 research questions were really getting at. It involved an online survey that we issued, as well as subsequent interviews with homeowners. We sort of framed this in theory that we got from the literature, things like health behavior theory, the historical and policy aspects of carbon monoxide prevention, as well as talking with subject matter experts. So I want to make a point here. Had we taken a more equitable approach, if we were interested in, the public health equity side of this, we might have chosen a different group of people to interview. We chose homeowners because they were within reach for us, right? They were accessible given a short academic year, given our own networks. That's really how we did our recruitment, through our networks and then snowballing from there. But an equity lens might have told us, maybe it's more important to focus on, let's say, tenants who have different social determinants of health than do homeowners. So I just wanted to make that point here. There are several limitations to this study. One being, it's not nearly representative of all people in Canada. However, we do think that the takeaways provide insight for a larger scale picture. So something to keep in mind. If we go to the next slide, I'm going to walk you through some of our key findings. So this first one comes from the survey. And in our survey, one of the questions we asked was, how important is knowing about carbon monoxide to you? And this is the distribution of the responses that we get. So naturally, right, we have a higher tendency to say it's important, which is great to see. We've got some people who say it's not important. Okay. But what we were interested in most was this middle section. What does neutrality look like in this case? What do people really mean? Are they really, I'm on the fence? Or is this really a case of it depends? And that it depends is where a lot of the nuances around prevention and preventive action take place. So we really wanted to uncover that. What do people mean if it depends, right? And maybe once we understand that, we can start to shift their perspective to the more important side of the scale. Next slide, please. We will now look at, I'm going to take you through 5 findings from our interviews, and we'll go through them kind of quickly, but we'll look at them all together at the end as a snapshot. So for the first one, there's a reliance on professionals such as realtors, home inspectors, building contractors, even city officials who deal with building permits. There's a reliance that they will take care of the home health aspects for somebody who is going through the home buying process. If we go on to the next slide, context is critical for somebody's understanding of risk. Context includes their immediate home environment. So what type of appliances do they have, right? Do they have fuel burning appliances like MaryAnne was mentioning, or do they have electrical? The type of home that they're living in, right? Is it a house or is it a condo? We often found that condo owners were pointing to the condo board and saying, oh, they take care of that. They take care of the home health aspects. Also, context in terms of timing, the setting that they're in, maybe the market that they're trying to buy a house in. They might not care as much about carbon monoxide or other home health hazards if it's a very hot market, right? And they feel they need to act quickly. Going on to number 3, motivators to taking preventive action include if somebody has a past experience with this hazard, in this case, carbon monoxide, or if they have dependents. This is what we found, right? There's an emotional quality. Number 4, seeing is believing. We heard this quite a bit, and you can see participant number 4's quote really sums it up. I can't see it. I can't smell it. Yeah, I know it's important, but overall, it's not a top of mind issue for me. That was a strong message that we heard. And then the last message was about information usability. And I think this one might be important for this working group, right? And you may have come across this in your own work. As you look to, right, communicate this sort of messaging to the public on how they can take action and protect themselves and their families, how that information is received is so critical, right? In this case, if people don't understand what the audio output from a carbon monoxide detector is telling them, right? If they don't understand the difference in the beeps and they don't have a user manual on hand, and maybe the device doesn't have the labeling directly on it, then they might be in danger of giving up entirely, like this person did. So let's take a look on the next slide at all of these findings together. And this, I would say, is the most important slide in this deck. So I'll take a moment to pause here and to tell you that this is where we start to bridge from our research findings into an intervention. And so I'd encourage you to think about in your own work, whether you work with carbon monoxide or maybe another poisoning, whether you do engagement work directly with end users or you're a little bit upstream, consider how this might look in your own line of work. And if it's easier, you could frame some of these prompts into questions. So for instance, for the first one, how might we in our poisoning prevention work involve trusted parties, whether those are professionals or people within, social circles of the individuals that we're concerned about? How might we make it make sense for their situation? Acknowledging what they know, right? For instance, okay, you live in a condo, you're very knowledgeable about carbon monoxide sources in your home environment. That's great. And here's how we can equip you with further knowledge, right? For example, when you travel, have you considered protecting yourself from carbon monoxide when you traveled by bringing a detector with you, let's say? Have you considered, like MaryAnne mentioned, during a power outage, is it possible that you'll borrow a generator from a friend or a family member? And will you be thinking in that moment about, right, the dangers of carbon monoxide? If I jump to the last one, number 5, help me understand what I need to do. How can we make the information timely for folks, especially if it's in a moment of urgency like that? Next slide, please. I'm gonna now give you just a small snapshot of what this could look like in the form of an intervention. And I will say here that in practice, the research and the findings don't jump this quickly to the implementation. There's actually a full design process in here that involves, coming up with ideas, prioritizing those ideas based on the effort that they'll take and the impact. So for example, what our team ended up going with was a more readily implementable pilot solution, right? Sort of a low-hanging fruit. But what you might be interested in your own work is maybe a longer term solution like policy, let's say, that takes more effort and more time, but the impact is greater. And you might see that, for instance, from Samantha and John next, right? Some of these interventions. The process also involves validating with end users, right? As you're going along and coming up with these ideas, going to them, right? The people that you're trying to help and working with them to make sure that, yes, this messaging is going to resonate with them. And maybe they'll give you some feedback for how it could be even better. So we'll get into some of the solutions that my team proposed on the next slide. And again, it's not this quick of a jump, but what I'll say is that if you can not recreate the wheel, right? If you can rebuild or build off of something that's existing, right? Taking inspiration from some things that are already out there and build partnerships that might get you, right, several steps ahead in your intervention. So in our case, we proposed a two-prong approach. And you might recognize some of these. So the first prong was to go through school children and to educate them, for example, through municipal fire education services. And maybe Samantha, it would be great to hear your feedback on this idea afterwards. Sparky the fire dog is a familiar figure to some people. We thought, what if we leverage that, right? What if we leverage that channel and we offer, say, a counterpart icon, and it could be, you know, Coco the carbon monoxide cat, right? And use those trusted figures already going into the community and achieving that emotional resonance that we saw, right? That we heard from our participants. The second prong that we proposed was, again, leveraging something that already exists. It's a red tagging system that home technicians apply when an appliance is essentially out of service, right? It's too dangerous to operate. So they put a red tag on it and they make it visible, right? You cannot use this until it's fixed. So we thought, what if we go that route too? And in this way, we're trying to visualize the invisible, right? Make it a more top of mind issue for folks. Next slide, we see how this could look from an implementation perspective. So, you know, the organization that's behind this program, whether it's yours, whether it's, you know, the public health agency, partnering, right, with professionals in the community and using those existing channels to deliver the materials and the messaging that you're trying to get out to the community. And so a human-centered design approach in this sense caters to, you know, the end users, in this case, right, the homeowners that we were trying to convey this messaging to, and also to the partners involved, right? We want to make it easy for them. We want to build it into already existing practices. And with the last slide, I'll conclude this presentation, and I'll just reiterate, you know, I hope you can walk away today with some takeaways for your own work. And I'd encourage you to make some bridges between, you know, the context here, which was quite small, and what you're working on. So thank you.
Oh, wonderful. Thank you, Christy. That's such insightful work that you've done. I know I've learned a lot. It's really important to consider the human factor, consider what all the different factors that are playing into people's decision making, which may be conscious or unconscious. So really critical when we're planning interventions. In the chat, we're seeing some really positive responses to seeing Sparky. And I love the idea of even Sparky can't sniff out CO. What a great concept. So I think you might have some brainstormers here who'd be certainly interested in talking more about campaigns. Thanks everyone for your excitement. And our final presentation is from John and Samantha. So please take it away.
You want me to go, Samantha? Okay, my name's John Janak, and I'm the Executive Director of the Hoffmann Janak Foundation. My journey began when, in 2008, I lost my niece, her husband, and both their children to carbon monoxide. At the time, I was still on the fire department and was investigating carbon monoxide after the tragedy, and found that education, carbon monoxide detectors, there was such a small knowledge based on that incident. So I started up the Hoffmann Janak Foundation for CO education. The reason we started up the foundation was so that we could spread the word about the dangers of carbon monoxide, get everybody to get a proper CO alarm in their homes, and of course work on passing the laws. At the time, we found there was, like I said, no education and very little knowledge about the carbon monoxide. So we're talking back in 2008, 2009. So fast forward to now, and we can see a huge difference. The fight against the silent killer for the foundation was, number one, get CO alarms in the homes. That's the only way we know the dangers are in the home. The number two was pass the laws right across Canada. And so far, we have been able to pass the laws in Ontario called the Hawkins-Janak Act, and then also in the Yukon Territories and in the Northwest Territories. So it's very important for us to make sure that all the laws are equally protecting all Canadian citizens. So therefore, we are working diligently on passing the laws in every province. Right now, we're working down in the Maritime provinces and hoping that we can get the laws passed down there to protect the citizens. It's so important because once we pass the laws, we see a huge a spike in people getting CO alarms. And of course, after that is done, and that's our first line of defense, as well as the CO alarms, we automatically move on to education. Education to me is very, very important, and it's very hard to keep up the education level because you have to come up with new ideas all the time. And education is very simple to me. Get to the children in the schools, and we have Ricky, the CO safety ranger now, with Coco, the cat, that's spreading the dangers about carbon monoxide to the children. We give them coloring books. They take them home to the parents. The parents go over it with them. They sign the book and they take it back to the schools, and they get an award plaque from our foundation as well as hats. So education to me, with the fire department, and I lean a lot on the fire departments because that's where I came from, they are very good at giving the education out to all their people in their relative communities. So we work very hard as well with the volunteers who need our help because they have very little funding, and they also need our help as far as providing them with CO alarms so that they can start programs like keeping senior citizens in their homes. As well, our successes to date. In 2013, the Yukon Territories was the very first ones to pass the laws in Canada. A lot of people thought it was Ontario, but it was Yukon Territories. And it happened after they lost 5 members of one family in a tragedy that happened in the Yukon Territories. Our tragedy at the time, 2008, 2009, was the biggest tragedy in Canada. And then now fast forward 2013, we have more tragedies happening. So our foundation went out to the Yukon Territories, worked diligently with them, and we had the members of parliament there pass the law as well. And then in Ontario, we worked with Ernie Hardman. So you need to get a champion to get the law passed. And right now, I think the most effective way to get this done is to do it federally. So we need to get the federal government to pass a law and make it equally protecting all Canadian citizens right across Canada. We've seen changes to the building codes and bylaws. They're good and they're helping the communities, but the overall protection has to be federal or a provincial legislation. Provinces with some protection that I found out is Alberta, of course, Ontario, Yukon Territories, Manitoba, Quebec, and Saskatchewan. No laws or no protection for the eastern provinces, who have probably the worst weather patterns that we've ever seen. So I think it's very important that our foundation is spread pretty thin, but we do as much as we possibly can to help educate people through all the different agencies like Technical Safety Standards Association and the Insurance Board of Canada. And of course, we are a member of the Fire Marshal's Public Fire Safety Council. And that is very rewarding because we come up with new education materials all the time. It's a changing landscape. The law was passed in 2015. We're finding now, fast forward 8 years, people have now it's time to replace those detectors, and some of them are not. So we need to come up with a new plan to shock these people into making them put new CO alarms and replace them as soon as possible. Overall, I think the foundation has made great inroads. We have been a part of the laws. We've written the laws, and I've also been a part of tons of education. And I can't thank people like Samantha enough for the work that they do. What's next for us? Like I just said, we need to get into I have a meeting with the member of parliament actually on Friday to talk to them about getting this law done federally so that all provinces and all citizens are protected equally against the silent killer carbon monoxide. We all know the only way that we're ever going to protect everybody from carbon monoxide is put those CO alarms in the homes and make sure they know how to look after those alarms. You look after that alarm, it'll look after you. And that's what we're having trouble with right now, getting people to replace those alarms, realizing that they only last for 10 years. these new sealed battery detectors, to me, are a godsend, because it keeps people from being able to take those batteries out, and the detector is no longer good. So and also new education. We have new education coming out with Ricky, the CO Safety Ranger. We'd love to partner him up with Sparky, the CO Sparky, but it's a hard thing to do, but we're working on it. And Coco, the cat, he's coming on board as well. So we're looking forward to that, and also developing new reading materials for the children in the schools. We have targeted 5 to 12-year-olds with Ricky, the CO Safety Ranger, but we need to get to the 12 to 18-year-olds, so they take this information home and make it important to their parents. So we're looking at making a new comic strip, and also we're engaging the children from 12 to 18 and asking them, what do you think about this? Or, what can we do to make your fellow friends, etc., aware of the dangers of carbon monoxide? And it's been rewarding so far. We're coming up with some great ideas, especially in the high schools. So all in all, it's education, getting CO alarms put in the home, but most of all, getting the laws passed. And also, I'm open to all new ideas from anybody that brings them forth, like working with the agency. So the three things that we target at the foundation is educate yourself about the dangers of carbon monoxide, get a CO alarm in your home and put it in today, and make sure that it's not outdated and it's looked after properly. And number 3, that you have your appliances checked by a qualified technician every year. And that way you can keep carbon monoxide away from your friends and your family. So that's what I have to say today. And I appreciate everybody that's done the presentation. I've learned some facts today, and I thank you for having me.
Thanks, John. I'm happy to be here. I've heard a lot of really, really good information that we're, as the fire service, are always trying to get out into our communities. So for my part of the presentation, I thought I would just talk about some of the myths that we see and how that impacts us in the fire service when it comes to actual carbon monoxide emergencies. If you go to the first slide, we know that people do think that it has a distinct odor. And often when people are calling in because their alarms are ringing, our dispatchers have to tell them to leave the home. So even though the alarm is ringing, because they can't see it, taste it, or smell it, they have a fear of first of all, calling us and calling 911. And then when they call, they don't think it's serious enough to actually leave the home. So there's always that ongoing battle with them to get outside into fresh air. Next slide. So the fact that carbon monoxide alarms aren't necessary, we know, we've heard all of these different presentations that they absolutely are. I think that MaryAnne and Christine both spoke about condo livers, people that live in condos or tall buildings. Or people that don't have gas fireplaces or gas appliances. They often think that they don't need to have an alarm, and we know that they do. We have responded to a carbon monoxide call in a tall building, and it was one of the boilers that caused the alarm to activate. It was on the roof, and yet the carbon monoxide levels in the building on the 5th and 6th floor were the highest in the building. So the legislation doesn't even require a carbon monoxide alarm there, but that's where we were seeing the highest levels of carbon monoxide. So we need to make sure that everybody has carbon monoxide alarms, regardless of where they are in the floor of a tall building. Next one. People think that if they just crack a window, they can prevent the carbon monoxide from building up. And we actually know that that is not the case, that it will give you a little bit of a reprieve, but carbon monoxide is accumulative, so it will continue to build. It'll stay in your drywall. And what happens is that when you open the window, or if you open a door after calling us, when our firefighters go in to respond to the call, they don't pick up any carbon monoxide readings. And then it's very easy for people to think, oh, it's just a faulty detector. So the best thing that you can do is have your equipment serviced annually by a professional, have your carbon monoxide alarm, and if your alarm activates, have a plan so that you know to immediately just get outside. Don't worry about opening windows or doors and getting fresh air into the house. Just get you and your family outside. Next one. This we get asked a lot about carbon monoxide being heavier than air and sinking to the ground. We know that carbon monoxide mixes freely with the air. When it comes to smoke alarms, it's very easy for us to tell people that the smoke goes up and to put your smoke alarm on the ceiling. Carbon monoxide, because it mixes freely with the air, your alarm doesn't have to be on the ceiling. And you'll see that when you go shopping for a carbon monoxide alarm, you can find the dual ones that are combined with a smoke alarm. You'll find the plug-in type that are down low at knee level. And you'll find the one that you can just put on a table or a desk. The other thing that we find is that people have their carbon monoxide alarms and then they put furniture in front of them. And they stop the airflow from getting into the alarm, which delays its response. So if you are having a carbon monoxide alarm, you want to make sure that the airflow around that alarm is accessible and that the air can get into the alarm so that it can do the job that it's designed for. Next one. So people think we only respond to carbon monoxide calls when there's a fire. That is not true. We will respond anytime a carbon monoxide alarm rings, as long as the homeowner calls us and lets us know. So similar to what Christine said when she was talking about the human behavior, again, because they can't see it, taste it, or smell it, people have a fear of calling 911 and they don't call us. Or the alarm might sound and then stop, so they don't call us. We actually had a situation in our dispatch center where one of our firefighters' wives called to tell him that the alarm was ringing. And he said, why didn't you just hang up and call 911? She says, no, there's nothing in the house. I'm just letting you know that it's ringing. So, and when the firefighters responded, they found that the house had an attached garage, and they would start their car in the morning, let it run till it warmed up, and then back it out. So what was happening was the carbon monoxide was accumulating. It was getting in through the central vac system that they had in their garage right into their house, and it was eventually building up till it got to the point that the alarm was activated. So we will respond to any time there is a concern for carbon monoxide. Next call. So we've heard about this both from MaryAnne about the flu-like symptoms. One of the things that we always tell people as the fire service is if everybody in your house gets sick at the same time, that should be a warning to you, because that's not really how the flu works. It seems to go, one person gets sick and then a day later somebody else does. Another thing that we tell people to watch for is if you leave the house and if you're not feeling well when you're home, but you go to work or you leave the house and you feel better, you get home, you start to get a headache, you start to feel sick again, that could be a warning as well. We have all these intuitions or things that happen to us, but it's very easy for us to just ignore them. And what we really want people to do is not ignore the warning signs and not ignore the warning symptoms. So your physical symptoms can be, and they could be different from one person to another. It could be the flu, it could be a headache, it could be dizziness, the confusion. So we talked about that earlier. Next myth. Carbon monoxide alarms do not last forever, as John mentioned. The new carbon monoxide alarms do have a 10-year, or a lot of them do have the 10-year long life lithium battery. We did have an issue where most carbon monoxide alarms, when they were first initially put into the smoke alarms, the combined units, they only had a 7-year lifespan, where the smoke alarm had a 10-year lifespan. So we've had situations where we've gone to a home and the end of life sounded on the carbon monoxide alarm, but the date still showed that the smoke alarm was okay. So there is lots of confusion. It's really important that people know when their carbon monoxide alarm was purchased and when it was installed, and have that date on it. We've also responded to a call one time. It actually came into our prevention branch. A woman called in and said, you know, I smelled something funny in my house, and I don't think it's anything, and I don't want to call 911. We sent the truck over, and it turned out that their furnace they actually smelt the dust on their furnace. That's what the smell was that was burning, but the carbon monoxide levels in the home were at dangerously high levels. And they did have a carbon monoxide alarm, but it was 5 years out of date. And they had the alarm, they just never thought to replace it, which again goes back to that human behavior. Next myth. All carbon monoxide alarms are the same. Not all carbon monoxide alarms are the same. It's much like when you buy a car, you can buy a Honda, or you can buy a Ford. They're going to have different devices or different products that are available to you. All carbon monoxide alarms must meet the CSA standard. They must show the CSA logo, which I've got on there. And you want to make sure when you're purchasing a carbon monoxide that it has been tested by the approved location. We have had situations where people have bought carbon monoxide alarms online. They are not certified to be used in Canada. We had a fatality in a community that I worked in where the person passed away from carbon monoxide poisoning. They had alarms in the house, and none of them had been approved for use in Canada, and none of them were activated. So it's really important when people are buying their carbon monoxide alarm or any life safety device that they purchase it from a reputable company and make sure that it meets the standards for our country. Next myth. The standard shows, this is how the standard is set up for all carbon monoxide alarms. So you will not get a warning if if the carbon monoxide is at 30 parts per million for 30 days. If it reaches 70 parts per million, but less than for 60 minutes, 150 parts per million for less than 10 minutes, and 400 parts per million for less than 4 minutes. So when people talk about alarm locations, and a lot of times people think that their biggest risk is by the furnace, and they put their carbon monoxide alarm down by their furnace, every time your furnace kicks on and starts up again, it pushes out a little bit of carbon monoxide. So the alarms are designed so that it wouldn't cause a false alarm, but it does show that there is carbon monoxide. It will read that there is carbon monoxide. Next slide. So what the standard does require is that the alarm must ring if it's 70 parts per million between 1 and 4 hours, 150 parts per million between 10 hours and 50 minutes, or 400 parts per million between 4 and 15 minutes. So when you're at risk from carbon monoxide poisoning, you're at risk if you have a lot of carbon monoxide in a short period of time, or a small amount of carbon monoxide over a long period of time. So the alarms are designed to meet those standards. They also say that the carbon monoxide alarm must last at least 3 years, and it must have the replacement date on it, or it must have a beep to let you know that the alarm is at its end of life. If you do not see the CSA label, if you do not see the replace by date, if you do not have an end of life, then your alarm is too old and you need to replace it because it was done before the standard was introduced. Next. So we went through this already. This is where the usual suspects for carbon monoxide, but we need to think about other things as well. Next slide. The fact that carbon monoxide alarms are faulty, and I will tell you that our firefighters are guilty of this as well. It's very easy for people to go in, use a reader, not see any carbon monoxide present, and the natural thing going under that human behavior is, oh, it must be a faulty alarm. And we know that actually the alarms are very, very seldom faulty. Very seldom will you get a false alarm from a carbon monoxide alarm. They have a detector in it that will let you know if the sensor is not working. The battery will signify to let you know if the battery is low. But just because your carbon monoxide alarm goes off and you cannot determine you can't find a cause of the carbon monoxide, it doesn't mean that you're not at risk from carbon monoxide poisoning. So some of the things that we'll look at, if you go to the next slide. You need to consider we're making our home so airtight now. So you need to consider the negative pressure in the home. Everything is airtight. And you could have a carbon monoxide situation. It actually happened in my house. One December, it was minus 21 degrees outside. We were sitting watching a movie with the kids. We had a fire in our fireplace. We let the fireplace, the fire burn out, like slowly burn out. The kids were in bed. We went to sleep. And at about 12:30 in the morning, the carbon monoxide alarm up by my sleeping area activated. I got up and I looked through the house. I looked everywhere. I didn't see anything. I unplugged that carbon monoxide alarm because I figured, oh, maybe it's a faulty alarm, which is what everybody does. I went down to the main floor, got the carbon monoxide alarm that I have there, brought it upstairs and plugged it in, and went back to sleep. And half an hour later, that second alarm was ringing. So I knew right away that this is an issue. Got the kids out, the dog, everybody went to the neighbors. I stayed at the house, out on the front of the house, waiting for the firefighters. And when they arrived, it turned out that because it was so cold outside and we had that slow smoldering fire in the fireplace, the cold created that stack effect, didn't allow the smoke and carbon monoxide to release through the furnace, and it actually was being pushed into the house. So it can create that negative pressure in a home. The same thing when you hear of people that run their cars in the garage and they think it's okay. The cold can actually stop the exhaust from your car coming out of the garage, which is why it goes back into the house, into all of those access points that you have from your garage into your home. Next slide. You also need to consider these things that might cause your carbon monoxide alarm to go up. Moisture in the bathroom, low battery, household cleaners, ammonia from a litter box, the end of life alarm, an attached garage, or a central vac system. There are lots of other things that can cause your alarm to activate. That doesn't mean it's a false alarm. Next. I think we're just about done here talking about false alarms. Go to the next one. We talked about this. You will know. Don't keep your carbon monoxide alarm by your furnace. Put it by your sleeping area. If your furnace is the cause of the carbon monoxide, it's going to be pushed through all of your air vents. It's going to impact you while you're sleeping in your bedroom. And if the alarm rings, you might just build that alarm sound into your dream and not actually respond to it. It needs to be right by your sleeping area. Next. We talked about the alarm locations, and I think that is the end of it. That's a lot of information in a very short period of time.
Thank you, Samantha and John. John, thank you for sharing your personal story and, of course, all of the work that you've done based on your experience. And Samantha, such a wealth of knowledge. I think this detailed information is really important for folks to implement proper use of their alarms. I know we've gotten lots of questions about alarm locations and things like that. So, not making assumptions of what people know and sharing these specific information can really help people. So we appreciate all of your knowledge. We do have a couple minutes left where we can ask some questions to our speakers. So I'm going to ask Sarah to hop on. Sarah, do you want to start with one of the questions that was submitted before the webinar by a registrant?
Yeah, definitely. Thanks, Steph, and thanks to our presenters for such excellent presentations. So we did have one question submitted beforehand with respect to finding a decedent. So are there any external signs of carbon monoxide poisoning that you can identify when you find a decedent? And maybe I will direct that question to MaryAnne.
Yes, thank you. Typically, there are no outward physical signs of somebody that has passed with regard to CO poisoning. Some people will say that there's this cherry red color appearance to the skin. That is typically when levels are extremely high, but also about less than 5% of victims would have this appearance.
Thanks, MaryAnne, for that answer there. We do have another question that came into the chat during the webinar today with respect to the wildfires and wildfire smoke that we see particularly in the West. So is there any data or intel on the trends around CO poisoning risk in association with wildfires? And I'll open that up to any of our speakers that might have thoughts on that.
I can speak for our poison center. We do take calls, people that have concerns about wildfire smoke, but we specifically do not keep stats in terms of carbon monoxide because it's mostly particulate matter that accumulates that is more of a concern.
Thanks, MaryAnne. Did anyone else have any thoughts on the wildfire before I move on to the next question here? Okay, I'll move on to another sort of similar question relating to COVID and whether that has changed the landscape in terms of educating folks about CO poisoning. The question was about whether when people are thinking about their flu-like symptoms, they might think of the flu, they might think of COVID. It might add to the list of things people are thinking about before they think of CO poisoning. So I'll open that up to all of our speakers if you have any thoughts or responses to that question.
I can speak to that. I will say that we did see a decrease in calls where people are afraid to call in and report that they have symptoms because of COVID. I don't have statistics, but I would expect that absolutely people are going to be reluctant to call or even think about carbon monoxide when everyone is concentrating on COVID.
Thanks, Samantha. And maybe one more question. I know we have 1 minute left. And maybe I'll direct this one to John if you feel he could speak to this. Is there any sense among lawmakers and advocacy groups that CO alarms will become required by law on every level anytime soon? Do you have a sense for the landscape there?
That's something that we have been working on to change the laws. Two things with the laws is that we want to change it from outside your sleeping quarters to every floor of the home, and also to have education more for the alarms themselves. So yeah, we're working with the governments on the changes of the laws, but it's difficult to get them to open it up. We have to open up the Fire Prevention and Protection Act. So those are some of the things that we would like to change for sure. And also, CO Awareness Week is too close to Fire Prevention Week, so we would like to change it to another month.
Thanks, John.
Excellent. Thanks, Sarah. And maybe get CO Awareness Week across the country. I believe now it's observed in Ontario and BC provincially, and maybe we'd like to see that movement grow to give us an opportunity to draw attention. Thank you all so much to our incredible speakers. We're already getting feedback in the chat that you've provided valuable information and folks have learned so much from this session. Thank you to all the participants to join us. As a reminder, we will be following up with you with the recording. We'll also include some links to some of the resources mentioned today and infographics. I think that will be of interest in follow-up. And a reminder, if you can please fill out the quick evaluation survey on your way out, that would really help us. Thank you again, and